Royal Roads University acknowledges that the campus is located on the traditional lands of the Kasapsan and the Lekwungen ancestors and families, who have lived here for thousands of years.
I think we need a health system that's responsive and sensitive and provides genuine nurturance and care and healing to people. And I don't think we're quite there yet. I think we can get there by listening to patients and starting to do what they suggest. I'm Elizabeth Hartney. I'm a professor of leadership here at Royal Roads University, and I specialise in healthcare, health systems and promoting patient-centred care across the health system. I think the goal that I'm focused on is around improving the patient experience. We have all kinds of fantastic healthcare treatments available, but if the patients don't feel safe in the system, if they don't feel safe, for example, coming into hospital or engaging with their physician, then they're not going to get the benefits of those health innovations. When people are getting older, they often have a need for urgent care. And that's really what emergency departments should be all about. But what we're finding in some of our First Nations communities, what I discovered through engaging with the health authorities, was that sometimes older adults in First Nations communities don't actually feel safe coming into the hospital. They would either delay coming into the hospital until their situation was very severe and difficult to treat, or perhaps not come into the hospital at all and perhaps not receive the necessary care and then pass away at a time when they could have received care that could have kept them alive for longer. For the last couple of years, I've been working with one of the First Nations communities in Port Alberni, and one of our graduate students, Eunice Joe, has actually been working with elders in that community to talk about how we can improve the experience in the hospital, both in terms of the physical environment and what they experience when they come in, and the interpersonal relationships between the physicians, the staff, the nurses, and the patients. And then thinking about primary care, working with people who use substances and their access to primary care. Now they're actually one of our most vulnerable patient populations in terms of health vulnerability. So not only do they have treatment needs focused on their substance use and all of the physical ramifications of that, but they're also vulnerable to other health conditions, more vulnerable than other people. But they often miss out on that crucial screening, assessment, and referral into specialised care because of stigma associated with their substance use. So again, they might avoid coming in for treatment. We might find that when they do come in for treatment, it's fixated on their substance using behaviour and trying to control that rather than actually treating some of the manifestations of it. And sometimes we actually miss really important health issues that perhaps would have happened anyway that aren't screened for and treated because they're specifically labelled as a substance use case. So we've been working with physicians and patients for the last couple of years to develop best practices to improve the level of patient support, the level of cultural safety for people who use substances in primary care. There's all kinds of complex interpersonal and psychological issues that are going on the part of both the patient and the physician. What we did at Royal Roads was bring these two groups together to collaborate, to actually figure out what kind of advice, best advice can we give to physicians to create a warm, safe, welcoming environment where people do feel able to get the help that they need. I think access to healthcare should be a basic human right. I think it should be available to everybody. And I think if we're in positions of leadership, then we should be doing all that we can and all that we know is going to help society to be healthier.